It began with offering refuge for street dwellers with nowhere to go amid the Luzon lockdown. Now, De La Salle College of St. Benilde's Project Safe Shelter has expanded to helping medical frontliners. To tell us more about that, we have Brother Dodo Fernandez. Good afternoon, and thank you for joining us, brother.
Good afternoon, Rika. How are you?
I'm doing good, and I'm hopeful that you're doing good the same way as well.
Yes.
All right.
Even the difficult situation, all is well.
That's nice to hear, brother. Now, we have already heard of Project Safe Shelter before, helping our frontliners, helping the homeless, rather, before, and now you're already extending your help for frontliners of our country. Can you tell us more about this, please?
That's right. We, the De La Salle brothers, the La Salle schools in the Philippines actually have been trying to help all our healthcare workers, our hospitals. La Salle Green Hills has been partnering with Medical City, and recently Philippine General Hospital wrote us, and College of St. Benilde was the school that was nearest PGH, so we opened up our facilities for their healthcare workers.
Brother, I understand that this is a nationwide thing that the De La Salle and CSB are doing. May I ask, which university facilities are already operational since you started the project?
Right. We have our school in De La Salle, Lipa, opened its campus to several hospitals in the Lipa area. I think University of St. La Salle also has been opening up its campus to several hospitals. We have a hospital ourselves in De La Salle, in Dasmariñas, De La Salle Health Sciences Institute and Medical Center, and it is in fact a testing center.
Brother, I understand that classrooms and facilities are being used for our health workers. So far as of this moment, do you have any data of how many we have already been helping?
In College of St. Benilde, we are housing about 60. Well, we promised to house about 60. The numbers came from PGH, but we opened last night and we had about 10 initially. We have 8 classrooms that we opened, but 2 were used last night, 5 in each. As per our agreement, there will only be about 8 healthcare workers per classroom. We provide them breakfast, and we have Wi-Fi also so that they can be in touch with their families. We provide them snacks as well as toiletries, soap, shampoo, and toothpaste.
That's a great help that you're giving for our health workers. Now, we understand that, of course, we also have to look into the safety and health measures. How are we doing that for them as well? That's
right. We're trying to, we in fact have a disinfection booth. This was approved first here in La Salle Green Hills by Medical City and then by PGH. So as they enter, we disinfect them, and as they come out, they are also disinfected. However, I think I need to share with you that those that stay with us are not the ones that are exposed. They're really secretaries and office workers. And that was the agreement with the hospitals that we worked with.
So these are not nurses, not medical professionals, but all the other...
some of them are technicians, but they're not, let me put it this way, they're not the ones that are directly exposed. I think the hospitals keep them. Those that are directly exposed to COVID-19 patients are housed in their own premises.
So for now, we're only using Project Safe Shelter to house our frontliners. What about the homeless people that we used to help before?
Oh, we do have. We have one facility in College of St. Benilde, our gym. We have housed 70. In fact, that was the first group that we did open ourselves to. This is a project together with the SVDs. I did visit it just this morning. We began with 70, but some of them opted to go home. So we're down to about 60 homeless people in our campus.
Brother, I'm curious as to how this works. Is this like a daily thing, or do the people we help come for an extended stay?
I'm sorry, can you repeat that?
Is this like a daily thing? How do you make this work? Do they come in on a day asking for a daily assistance or an extended stay?
No. Okay. this started during the lockdown, and the police were driving away the homeless people, and so they didn't have any place to go, and so we were approached by our partner, the SVDs. Those that are in our shelter are there permanent. Well, since the beginning, and it's been about a month now. We don't allow them to leave, but also we don't allow new ones to come in because they're already COVID free, and so we don't want them infected.
Now, brother, I've been seeing on the pictures that we have on screen that you're providing food, you're providing beds and mattresses. You mentioned earlier toiletries as well, and snacks for everybody that you're helping. What kind of assistance does Project Safe Shelter need? Do you need donations for provisions or what? Can we use this time to call it out?
Thank you. Well, we need as much help as we can. If there's people who want to donate food, we're open to that. If people want to, some people donate cash, and we keep that. But we're transparent with it. So every 2 or 3 days we come out with a list of donors. But any help is welcome.
All right. So what is the best option for us if we'd want to help you out? How can we be able to see the means of helping? Do you have like a Facebook page or something?
I would, 2 things: food and cash, because sometimes we need to buy linen, sometimes we need to buy beddings for them. But food would be the best option as of the moment.
All right. Thank you so much for your time, Brother Dodo Fernandez of the Del Salle College of St. Benel.